This week we told you about the CDC warning of a rise in flu, RSV, norovirus, and COVID cases. Seasonal illnesses are increasing right now, especially after all those family gatherings over the holidays. Doctors are recommending you wash your hands, keep your work areas clean, and get vaccinated if you have not already. If you are looking for some home remedies, our next guest has you covered. Here to help us simplify is Dr. Sarah Lychy with Sonoran University of Health Sciences. Doctor, thank you so much for being here today.
Good to be here.
I mean, everyone's sick, are they not?
I know, everyone's coming in, colds, sore throat, earaches, you know, name it. So lots of things happening.
Yeah, okay, so let's start over here because we want to start with number one is nutrition. What does that mean?
So there's lots we can do in the kitchen, super easy things. So stews, warming foods, nice soups, making sure that we're eating enough protein, putting some anti-inflammatory foods, so ginger, turmeric, cayenne, that can all help with our immune system.
What is enough protein?
It depends on the person. So talking to your doctor to see what the right amount is for you, and it just depends on your weight and kind of your goals.
Okay, so number two would be sleep. That's one that's very coveted, but often elusive.
Yeah, it's really important for us to be adequately sleeping enough hours to make sure we're getting restorative sleep. So something like a sleep mask, making sure that you have a nice dark environment, that it's cool, and that you're getting at least 8 hours.
Yeah, at least 8 hours, or repeat for everyone who feels like they need to, you know, work on their sleep in the new year. Our water intake, we talk about this all the time, but it can really help our immune system.
It can really help, especially making sure we're getting the right amount. So usually I recommend to my patients having half their body weight in ounces. Something that can be really helpful is adding electrolytes. It can make it a lot more enjoyable to drink and have those minerals that are really helpful to help heal our body and get that immune system going.
Okay, I've been waiting all day to talk to you about this one. Wet socks method. What's going on?
Yeah, it's a naturopathic doctor's favorite thing to recommend. So what we do is we take a bowl of ice cold water, you put your cotton socks in it, wring it out, put them on your feet, and then you put wool socks on top, and then you go to bed. So basically, it's stimulating the body to heal itself. So by the time you wake up in the morning, your feet are actually going to be dry. So we're basically enhancing circulation and making sure that we're just kind of giving that immune system an extra boost.
Is that something we do when we're sick, or
you can do it preventatively, or you can do it when you're feeling like, oh, you got that tickle in your throat, or you're starting to cough. It's a great time to start.
It sounds like a little mini ice bath challenge situation.
Exactly, yeah.
Okay, and then number 5 on our list was the steam inhalation. So tell me how this works.
So with steam inhalations, again, have a nice big bowl with hot water. Just be careful with the hot water. And then what you do is you place a towel over your head, kind of creating a tent. So then you're able to inhale that hot, steamy water. So with this, it helps thin out the nasal passages to any mucus production that's happening, and then also help with airways. So we can also add essential oils into it. However, with our pediatric patients, you always want to talk to your doctor before to make sure that it's safe for them.
What about good old-fashioned Vicks Vapor Rub? Are we still using that?
Of course, some people are still using that too. You can also just have a nice hot steamy shower, close the doors and make it nice and hot in there, and just breathe in that air.
So when do we go to the doctor? When do we call out from work?
I always recommend to my patients, if they're feeling unwell, to come into our clinic, because we love to individualize our care. So as you can see, there's some other supplements over here that we have at our medicinary that we commonly recommend. So if you come in, we can talk about what symptoms you're feeling and making sure that we're giving you a recommendation that's right for you.
Yeah, I have a tough time of, can I make it through my work day or not?
Yeah,
Give me the doctor's orders on that one.
Yeah, so if you're having a high fever, if your cough is still happening, you have that sore throat, and you're feeling that fatigue, and you just want to get checked out, I always recommend coming into the office.
So you're around sick people all the time. How do you stay healthy?
I do these recommendations. I try my best, and I practice what I preach, and I'm lucky to be surrounded by a group of great doctors at our clinic.
So do you go home to the wet sock theory?
Oh yes, you know it. Yeah, as soon as I'm starting to feel under the weather, I'm putting those socks on, and hopefully it's going to kind of kick it.
Yeah, I have some Christmas socks that I might put to work tonight.
Amazing.
Just to try it out.
I love it.
Thank you so much.
Yeah.
Stay well, stay healthy, and
You
great to see
too.
you. Happy New Year.
You too.
Hey, Paul, what's going on with the traffic?
All right, Jamie, let's take a look. Yeah.